Hello, all, and welcome to our April 11th, 2023 Helping Health podcast. This is your host,
Fatima,
Cassandra.
and Anai. We're going to be exploring substance-induced anxiety disorder, what it is, the types of substance being consumed and experimented with, side effects, and treatment options. So, let me ask you something. What is substance-induced anxiety disorder?
a mental condition that occurs when a person experiences anxiety symptoms after consuming psychoactive substances or drugs.
So, which kind of substances would that be?
So, alcohol and illegal drugs such as cocaine and LSD, non-prescription medicines, and other decongestants, other drugs, medicines can cause anxiety as well as caffeine. Prescription medicines such as stimulants, steroids, and other medications.
What are the side effects?
So, resulting in emotional upset, restlessness, panic, shortness of breath, palpitation, apnea, irritability, gastrointestinal distress, nausea, insomnia, chest pain, and dizziness can all be factors of substance-induced anxiety. These symptoms are significant, which requires intensive treatment, if not have a direct influence on the body and can be life-threatening.
So, who's usually affected?
Some groups would be minority issues and ethnic groups. They experience healthcare disparities related to mental disorders, which could lead to substance-induced anxiety disorder. Another status would be the socioeconomic status. They play a big role on how people deal with substance-induced anxiety disorder. I could mention how in urban areas, people don't have a lot of access to healthcare, so they put all their anxiety into substance-induced, and that's when they start suffering from substance-induced anxiety disorder.
How common is substance-induced anxiety?
So, substance abuse disorders and anxiety disorders are among the most common disorders in the United States, with alcohol related being at 26.1% and other drug substances at 22.9%. So, in 2020, 21% of adults in the US experienced mental illnesses. That's 52.9 million people, so that's a lot of people. This is representing 1 in 5 adults, and another 5.1.6 of the US adults experienced serious mental illnesses in the same year. So that's 14.2 million people, representing 1 in 20 adults. So these figures indicate that substance-induced disorders are growing at an alarming rate, a scenario that could be traumatizing if no measures are developed.
How can someone identify mental illness and what resources are available?
So they experience changes in their emotions. They typically have social problems. They get anxiety being in a social context, which causes them to feel feelings of distress. They also have a change in their behavior. They become more angry. They become more irritated and have less patience, or it can just be a combination of all of these factors too.
So I want to comment about a personal experience that relates to this. I experienced this with my brother. He was doing a lot of drugs to the point where we couldn't find him in 3 days. We don't know much of what he was doing. All I might know is that he was doing cocaine, and there was this instance where he got in a big fight with my mother, and my mom didn't intend to get him mad. It was not a big deal for him to get mad, but he did. So I guess he got fast, angry, and irritated, and he pushed my mother, and it was really hard. We all got mad and all that. However, the next day when we tried to comment about it, he couldn't remember anything. So do you guys think it affects their memory?
I think it does, to be honest. Taking any type of drug, or whether it be pills, cocaine, marijuana, alcohol, I feel like it does cause a chemical change in the brain, and it could cause people to, forget things that they did the previous day or hours before, whatever it may be. So going back to the resources that are available, there are thousands of narcotic anonymous locations globally and more than 50,000 AA groups nationwide. There's also the Smart Recovery, which is a self-management and recovery training, family-oriented, religious, community networks that all provide peer support to people facing similar substance difficulties. So there's also the Smart Recovery, which is like a self-management and recovery training program. There's family-oriented, religious, community networks. These all provide peer support to people facing similar substance difficulties. They are free and help in continuing assistance to those addicted to alcohol or drugs in a communal setting. So typically the first step is admitting that you need assistance, apologizing for any pain or injury they may have caused. They're working to be better, and then they also are working to make individuals whole and create a way of living that reduces the temptation to drink. These groups complement one another well, but they're not meant to replace proven mental health treatment programs.
What are some of rehabilitation centers available in El Paso?
So there's the Atrium Inpatient Substance Abuse Treatment Center. This is a live-in program outside of El Paso, actually, in Santa Teresa, New Mexico. This is where, in this rehabilitation center, they're closely supervised. It's around-the-clock care. It can either be voluntary or involuntary. There's also Aliviane, which provides free of cost programs for prevention, intervention, and treatment, such as the Padre program, which is parenting awareness and drug risk education. This provides community-based intervention services for both parenting males and females at risk for involvement or currently involved with Department of Family and Protective Services with substance use disorders, or who are at risk of developing substance use disorders. So they're all there to support patients on their path to lifetime recovery.
Okay, so say someone cannot physically attend an appointment. What happens then?
So now with technology, now that everything evolved through COVID-19, there is the use of digital information and communication technologies, for example, computers, mobile devices, and tablets. Telehealth that offers many benefits for those with substance addiction disorders in those instances. Substance abuse populations can greatly benefit from telehealth service as it offers some relief.
Study done by Cone in 2019, substance use disorder telehealth intervention successfully lowered substance use and improved sobriety due to more immediate and consistent care. Also, patients also expressed high satisfaction with telehealth services, underlining the ease of shortened travel time as strengths. The combination of telehealth with mental health and substance abuse healthcare practices has the potential to transform the way these services are delivered.
So can you tell us more about the benefits of telehealth?
So the benefits of telehealth telehealth improves the quality of patient care. It reduces medical errors. It improves patient safety. It ensures the continuity of care and discharge procedures. It also helps to communicate with patients and educate them about their health, overall improving the health of the population. Positive outcomes and satisfaction, also leading to a better mental health and well-being.
It also helps with getting over obstacles that may prevent someone from getting treatment, lack of transportation, especially those in low-income or rural locations. Environmental factors, a person's family environment can have a very strong influence on a person's values, beliefs, and actions. Patients being more engaged, also likely to follow treatment plans. Those are the two main things that are important for the long-term success of therapies. Also, stigma attached to getting help.
So can I mention how I like the part where they help those with living in low income and rural locations, especially because I live in an urban area with low income is included. I like how it is helping, because I've noticed a lot that a lot of patient care and all that, it's all over here in El Paso. It's not a lot over there. And for us, the transportation, coming over here, like even just to put gas, it's really hard just because now how gas is coming with
Prices are high.
Yeah, prices are high. And it's really hard. Like even like I could mention how right now, even coming to school, it is for me like about an hour drive. So imagine like having to come more like weekly, 2 times a week just to get help. It is kind of hard. So I like how they are now helping low income and rural locations.
I also want to mention that I really like that you brought up stigma, because it is an important factor for people seeking help.
So let's talk more about stigma. Stigma is like a variety of shame. Number of studies show that stigma is widespread, long-lasting. The idea that addiction is a personal decision. It reveals more weakness and a lack of willpower. Stigmatization. I'm sorry, guys. I'm still struggling with that. Stigmatization rates are exceptionally high in general population among professions whose members deal with addiction. Stigma interferes with the quality of care people with substance use disorder receive in clinical settings and harms their health and well-being, according to research. Research indicates that use of person-first language is essential for stigma reduction, focusing on the person and not on his or her condition.
So what are the rehabilitation specialties for treatment?
So one of the main specialties for substance-induced anxiety disorder would be addiction psychiatrists. They are actually the most specialized. They studied about this, so they are the most able to be able to help you. Another one would be psychologists. They do play an integral role. They give counseling. They help manage anxiety and general anomalies. There is behavioral health therapists. They give different techniques for addressing anxiety disorder. They help the patient with coping, relax, and manage the existing stress. There is also psychotherapy that gives cognitive behavioral therapy and exposure therapy.
Okay, what treatment options are available?
Some treatment options that are available are counseling for mental health disorders. There are also individualized treatment programs and therapeutic alternatives. There is also medication treatment. They give selective serotonin that helps reuptake inhibitors, and there is also benzodiazepine that helps reduce symptoms that are caused with substance-induced anxiety disorder.
So how would someone manage this disorder?
So someone that can manage this disorder is first to get support, talk with friends and family, consider joining support groups in the area, contacting the healthcare provider or therapist if having any questions or symptoms that may seem to get worse. Learn to manage stress, find ways to relax. For example, taking up a hobby, listening to music, watching movies, or even taking long walks. Try deep breathing exercises when you feel stressed. And also, taking care of your physical health. Trying to get 7 to 9 hours of sleep each night, eating a healthy diet, limit caffeine and exercise. If you smoke, try to quit. And also, do not use alcohol or drugs and avoid situations with friends. And also, check your medicine. To help prevent problems, tell your healthcare provider, pharmacist about all of the medicines you are taking, natural remedies, vitamins, or other supplements. Take all medicines as directed by your provider or therapist. It is very important to take your medicine even when you're feeling or thinking you're feeling well. Without the medicine, your symptoms may not improve or may get worse. Many people might think substance abuse can help their anxiety, but it actually makes it worse over time.
So I want to ask you all, elaborating on this discussion, how do you all manage your stress and anxiety?
Okay, so for me, I do experience some anxiety. The ways I can say that I manage it is exercise. I definitely need to have consistent exercise after a workout. I do start feeling a lift off my shoulder. I feel a little bit more relaxed. So that does help. Also, when I'm really not able to manage my stress in any other way, because I do keep myself busy all times, I do take ashwagandha, which is a natural remedy supplement. So I do take that.
What does it help in?
So actually, it's more of like a kind of like melatonin. So if you do struggle to go to sleep at night, as we all probably do have some type of stress and anxiety that,
Especially with college.
I know. It's stressful.
It's stressful, the adult teen life.
especially with school, it can get stressful. So to help manage like my sleep or even my anxiety at times when I feel like a tight pressure on my chest, which is rarely, so I do take like that ashwagandha as a vitamin supplement. Within like 20 minutes, it kicks in and I'm able to fall asleep. So it's more like a relaxant herbal medicine.
Herbal.
It is herbal.
Okay.
Yeah.
So the good thing it is like natural, so it
Yeah.
wouldn't really affect your system.
Yeah,
So-
like
Like your chemical composition of the brain.
Yeah, because I mean, you know how drinking a lot of medication
Yeah, it'll.
affects you.
yeah, just like depression is a magnesium deficiency. I've heard it from physicians that say it. So magnesium is really important for your body, making sure that you have all the supplements so that your body can, able to manage those
That makes
stress
me feel normal.
Mm-hmm.
triggers. Yeah.
Annie, what about you?
To tell you guys the truth, like at the beginning, I would deal with my anxiety in the worst way possible.
How is that?
Honestly, I didn't know much about anxiety. It came later in life where a lot of things have happened to me lately. And all I ever did is I couldn't focus when I had anxiety. I couldn't focus, so what I would do is pinch myself, hit myself, try to make myself feel like I'm here. But it would take a lot of time, and it was kind of stressful for me. And I could have ended up hurting myself quite a few times.
You could. And how do you manage it now?
Well, I mean, thankfully now in the job I work, well, not thankfully, it has occurred to me that while I'm working, I am having a lot of anxiety. And when I first started to have anxiety, I would start going with my hands like that. So trying to like scratch myself to make myself instant. And my fellow coworkers, one saw me and he was like they tried to like stop me, and he was like, no, this is a better way to cope with it.
Yeah.
So he showed me that by laying down on the floor where it's cold, it's like it helps you like manage your anxiety, calming yourself. I know they actually gave me a fidget, so while I was laying down, I was playing with it, and it really calmed down. Like, I don't know if it would help everyone, but I know that in that moment it helped me a lot.
A fidget.
How about you, Cassandra?
So I manage my stress and anxiety from the time I wake up. I have gone to see a doctor. I have prescription for anxiety and depression and things like that, but I don't like to use it. I tried half of a pill one time and I felt like a zombie, so I don't like to do that. So I wake up, I have the same routine, I go to the gym, let some of that dopamine out, positive energy, positive vibes. So that's how I deal with mine. And then later at night, I do feel anxious also. So I downloaded some app, it's called Calm, and I listen to meditations. And I also listen to like rain and ocean waves and things like that. So all that helps me.
Does it actually help, the rain and all those calming?
I feel like it does. I feel like I turn it on and maybe within like 15, 20 minutes, I'm out. And I don't know, I love it.
I really need that. Thankfully, that like you giving that actually, because I honestly suffer a lot of sleeping. I guess I have anxiety or too much stress within me.
Yeah, just like thinking about what you're gonna do the next day.
And not even just thinking, like I don't know. Sometimes I'm not even thinking, but I just can't fall asleep. I'm tired. Like I'm like already yawning, and my eyes want to close, but they can't. Like I don't know. So I think I should actually
Like,
try
let
that.
me know. I'll give you my password and username.
Yes, because with that, yeah.
I feel like it seems like we all have our different like coping mechanisms, right, of dealing with stress and anxiety. I mean,
It is different ways that people deal with it. Like now we could see how Fatima deals with it with exercise and the natural
Herbal.
herb. And
Herbal
then,
medicine.
well, we could see how you,
exercise, kickboxing, and
lot of-
my little apps.
a lot of physical activity and the soothing sounds.
White noise.
White noise.
And well, with me, the case, I hit, but I'm trying to do it better. There's better ways, and now with this research, I've learned many different ways to actually do that. Do you guys want to try the breathing exercise I actually learned?
Yes, let's do it.
So we are gonna breathe in for 3 seconds. You guys have to hold it for 5 and release at 4. So it actually works better when we're standing up, but for now, let's actually practice it sitting down.
So breathe in for 3 seconds, hold 5, let out
4.
4. Okay.
So ready?
Yes.
Again. How do you guys feel about that exercise? Did it calm you
I
guys?
like it. I like the breathing exercises. It makes me feel more relaxed and more in
In the zone.
Yeah, in the zone.
In tuned.
Into
Yes, I agree.
That concludes our podcast today. Again, we are your hosts, Cassandra.
Fatima,
And Anai.
thank you.
Thank you.
Until next time, bye.